Well, I've got 1 o'clock, so there may be some people joining us later, but we're going to go ahead and get started. Good afternoon, everyone. I'm Laura Sauser. I'm the Executive Director of the Wisconsin Library Association, and I'm really happy to welcome you to today's webinar, Partnering to Connect Library Patrons to Health Insurance. Before I introduce our guest speaker, I want to mention just a few housekeeping items. You are muted and your cameras are off. If you have questions for our speaker as we go along, please type them into the question box on your screen, and we will take time either during the session or at the end of the presentation to go through them with our speaker. This webinar will be recorded and a link will be sent to all registered attendees after the program is over. Again, just a reminder that to also register for public libraries and healthier communities, a webinar will offer next week in partnership with the National Network of Libraries of Medicine. That webinar will take place on Wednesday, December 15th at 1 o'clock. And now it's my pleasure to introduce you to Courtney Harris, Outreach and Partner Relations Manager with Covering Wisconsin. You may have met her at our annual conference. She was there as an exhibitor and had the chance to meet with lots of our members. Courtney joined the Covering Wisconsin team in 2021. She supports the organization's current outreach work and identifies and develops new opportunities to reach consumers throughout the state, with a special focus on serving communities most at risk for lack of coverage and access to care. This includes building and strengthening relationships with partner organizations and community leaders and identifying mutually beneficial opportunities for partnership. Courtney comes to Covering Wisconsin with a background in social work and experience in program management, stakeholder engagement, and health and public benefits policy. She holds a Master's of Social Work from UW-Madison and a Bachelor's of Science in Psychology from UT Austin. So with that, I will turn it over to you, Courtney.
Thank you so much, Laura, and thank you to WLA and for all of you for having me today. I'm really excited to get to be a part of this series and to hopefully connect with some folks maybe that I met at the conference and maybe some new partners too. So thanks again for having me. Let's see. Like Laura shared, I am the Outreach and Partner Relations Manager at Covering Wisconsin. So I think my video will probably be on the recording, but just in case anyone's watching afterwards, that's what I look like. And just a little bit of kind of the plan for today, but like Laura said, if you have questions throughout, feel free to chat in the box and I'm happy to answer them. And then hopefully we'll have plenty of time at the end too for questions. I'm going to start off with just kind of a brief introduction of Covering Wisconsin, who we are and what we do, what our mission looks like, and then talk a little bit about why we're here, kind of why we're talking about opportunities for partnering with libraries on this particular issue. And then I'll talk a little bit about free enrollment assistance through Covering Wisconsin and other partner organizations throughout the state, and touch a little bit on what the health insurance options look like here in Wisconsin, not to really get in the weeds of policy and program information, but more just to provide some additional context about what we do as health insurance enrollment assistors, and to hopefully help you address some questions that patrons might have related to health insurance, and that might kind of lend itself to making a referral to an enrollment assister. So then on that front, I will talk through some tools that we have that can help you in making referrals of consumers to Covering Wisconsin and other enrollment assistance partners, and then talk about some of the free resources that we have available to share with you all too. So I'll go ahead and dive in. Covering Wisconsin, the organization that I work with, is a nonprofit that helps people in Wisconsin find and use health insurance coverage. We are housed at the University of Wisconsin here in Madison, but we also have offices in Milwaukee out of Community Advocates, in Rock and Walworth County, way up in northeastern Wisconsin, and then work with a number of different nonprofit subcontractors around the state too, to really cover the whole state with local enrollment assistors and virtually through statewide assistance offered through Covering Wisconsin. So I'll talk a lot about what that means, but kind of how we work towards that mission of helping people connect to coverage and care in Wisconsin is partially through doing outreach and education. So doing things like this, working with professionals and other community organizations and partners throughout the state to do training, to share resources, to co-develop resources, and also to do trainings and share resources directly with consumers and directly with the public. And we've been doing that since the early 2000s. That's been a part of our mission as an organization. And then in 2014, when the Affordable Care Act rolled out, we also became the state's navigator entity, which means we offer free one-on-one health insurance enrollment assistance to consumers throughout the state through a grant from the Centers for Medicare and Medicaid Services. And I'll talk a lot more about what that assistance looks like. So why are we here today? This isn't new for all of you. I just wanted to highlight some of the ways that, from my perspective, libraries are wonderful partners in this work. First, obviously, local community libraries are shared and safe community spaces for connection, and in some cases, in parts of our state, some of the only places that folks can come together to share information and to just be together as a community locally. And as librarians and resource staff at libraries, you also are very, very trusted sources of information. And so when folks are coming to you and asking questions and looking for information, we know that you all are very trusted, that folks come to you for information that will be unbiased and that will be fact-based and well-researched, thanks to all of your skills in research and analysis too. Of course, local community libraries are also often key access points for internet access and meeting space. So our navigators, when they're doing enrollment assistance, often work with libraries in partnership as a space to actually meet with consumers, to have that internet access, but also because there are often private, quiet spaces to sit down and talk with a consumer about what is a really personal choice around health insurance coverage and getting access to the services that they need. And so you all are a really important resource to us as enrollment assistors, not just for referrals and for everything I just shared, but also you have really important insights into your community and what the particular needs are of folks that you work with. And that is incredibly valuable to our team and our navigators. And then what do we do? So in partnership with libraries, how can Covering Wisconsin help support your work? First and foremost, we can support you and I can support you in building relationships with your local enrollment assistors, whether that's through Covering Wisconsin or one of our subcontractors locally. Many libraries already have close relationships with the navigators in your community. And so I want to continue to kind of build and support those relationships as well. And we also provide free outreach materials. I'm going to talk a lot more about what that looks like. And we can definitely explore too, if there are types of resources that would be of particular use to libraries. I would love to explore that with you all. And then we do a lot of consumer testing of how-to sheets on key health insurance educational topics. So when folks are coming to you with questions and you need some additional resources or are interested in additional, more educational resources to help folks through questions they might have about health insurance, we develop and provide those for free to communities as well. And I'll talk more about that. And then we do things like this, so we can provide trainings to library staff and leadership on educational sessions around health insurance, but also conversations like we're going to have today. I love to have those conversations one-on-one with library systems and with staff too. There's just some ways that we can work together, and hopefully we can explore together other ways that we can continue to do this work. So because I know that librarians are great with data and very interested in data, I wanted to also talk about why we're here from a perspective of who are we trying to reach. And I have a link on the screen here, and this will be in the slides as well, if we can send those out, to how you can find your local county data on insurance rates using the most recent census data that we have. But we know on a statewide level that at least 83%, and actually just today, CMS released some additional data that showed that in this open enrollment period, almost 95% of people that are applying through Healthcare.gov are qualifying for financial help. But prior to the American Rescue Plan, the data showed that about 83%, over 83% of Wisconsinites who are uninsured right now would qualify for either Medicaid or Badger Care or financial help through Healthcare.gov, and they just may not know how to access those resources. They may not think they're eligible, or just may need a little bit of support navigating what is a very complicated process. And so that is what our navigators and our organization is trying to focus on, is how can we really connect with and provide our services to and share our services with this 83% of folks that are out there who are eligible for these programs, but just haven't yet been able to connect with them. Now, what do our navigators do? So when I talk about free health insurance enrollment assistance and health insurance navigators in particular, our staff are federally certified and state licensed to provide free help statewide and year-round to consumers in finding health insurance plans and financial help to pay for those plans, to sign up, so actually to go through the application process for Healthcare.gov, for Badger Care Plus, or for Medicaid. And then really just to serve as a health insurance resource to address questions, really no matter how big or how small they are, especially when it comes to things like coverage transitions, and I'll talk a little bit more about that. But if folks are interested in, exploring their employer plan and not sure it's the best option for them, or maybe they're thinking about leaving a job or retiring early, or have left a job and are not covered in this moment, we're here as a resource to help folks explore their options at those really critical points in their lives. And then we also help after enrollment with things like billing and coverage problems. So if folks are having trouble getting services paid for by their plan, if they need to maybe appeal something that was denied by the health insurance plan, our navigators are adept at navigating those situations as well. And as part of our certification, we provide that service as well. So it's really from start to finish type of resource for folks when it comes to their health insurance coverage. Now, when I talked about how we work as the main navigator entity for the state, and then we work with nonprofits around the state as well to kind of provide that local enrollment assistance too. That's what this map shows here. We were really fortunate this year to receive a larger grant from the Centers for Medicaid and Medicaid Services for this work. So we were able to expand the number of organizations that we're working with to provide that direct health insurance navigator level of service. And so the map here, I know you might be able to see super clearly. It might be a little small on your screen, but the link to our website here will show you both this map, and then if you click on the map itself, it will open up to the contact information for each of these organizations. And you'll also get my contact information as well if you want to reach out, so that I can make sure that you're connected with your local enrollment assister. But across the state, even in the areas that are not just indicated as covered by Covering Wisconsin, our navigators are always here as kind of the backstop too. So we have a statewide presence, but then we also have folks that have local knowledge of the resources and plans in that particular area. But in addition to health insurance navigators, there are also other folks throughout the state that are providing this type of health insurance help for free. And those might include, you might have heard folks use the term certified application counselor. These are staff that are very often at places like community health centers or FQHCs. They're sometimes called locally. And these are staff that are also certified to provide this assistance for free. And there are also agents and brokers across the state, some that are affiliated with particular health insurance plans, but not all. There are also agents and brokers that provide assistance free of charge, kind of in an unbiased way across plans. And so Covering Wisconsin and navigators, that map that I showed that are those health insurance navigators, those are folks that have that certification as a navigator through CMS and receive some of that federal funding to provide this service across our state. But we are not the only ones that do this work. And so when I talk about how to make a referral to an enrollment assister, I'll show you our tool that will pull up not just navigators, but other folks that are providing the service for free too. And the bottom line is always just that there are many different free resources for folks when it comes to health insurance coverage and assistance. So we want to make sure that we are providing you all the resources to find those folks that will provide help free of charge, so consumers are not getting charged for this type of assistance and are not getting sucked up into some of the scams that are out there right now related to health insurance coverage, which I'll talk a little bit about later too. So what are the health insurance options that our navigators really focus on and work primarily with consumers to get connected to? In Wisconsin, our navigators primarily, and most of the consumers that we work with, are either seeking coverage through or applying for either Badger Care Plus or Medicaid, so the state's low cost or free comprehensive health insurance coverage that's provided by the state, or Healthcare.gov, or the federal health insurance marketplace. And Healthcare.gov coverage, or coverage through the marketplace, almost anyone can qualify for a plan through Healthcare.gov, but then financial help through tax credits is what is based on income. I will touch on this a little bit, but there are many different immigration statuses and immigrants to this country who have different statuses. Oh, darn it, my lights just turned off, so sorry. We try to be environmentally conscious here at the university, so pardon me. I'll talk a little bit about some of the options that are available for immigrants too, but in general, the programs that we're helping folks with are Badger Care Plus and Medicaid, or Healthcare.gov. When it comes to Badger Care and Medicaid, consumers can sign up at any time, so there's really no limitations on when folks can sign up. And then Healthcare.gov, we do have this, what's referred to as the open enrollment period, that's happening right now and goes through January 15th. But folks can often sign up outside of that period if they're going through one of those transitions that I mentioned earlier. And right now, because of the pandemic, there are even more opportunities for folks to sign up, even outside of open enrollment. So really, at any time of year, someone can connect with one of our enrollment assistors and a navigator to identify what their options are, even outside of that open enrollment period. So in terms of other options, of course, many folks also get coverage from their job, but you know, as people are trying to make the decision about what the best option is for them when it comes to that coverage, whether they should take up that coverage, or if perhaps there might be a different option for them, or they might qualify for something that would be a little bit more affordable or better for their health situation, we can help them navigate that situation too. Speaking of coverage transitions, a lot of folks also, as if they're leaving a job, may have access to what's called COBRA, and that is generally a relatively expensive option for people who are leaving their job. It ends up, this would be where you get to continue your employer-sponsored plan, but then you have to pay the full premium. So a lot of consumers, as they're going through these job transitions, will come to us to try and explore if they might have other more affordable options that would make sense for their health situation as an alternative to COBRA. The one program that our navigators are not licensed to provide detailed help in is Medicare. So although our navigators do help folks explore their full array of options and identify if Medicare is the best choice for them, we work really closely with our Aging and Disability Resource Centers. I included both a link here to the statewide resource and list of ADRCs, but also just the direct number to the ADRC in Dane County, and then the Medigap helpline, which are both statewide resources to help folks identify what their options are when it comes to Medicare, and then help with the application process as well. And then other options, I mentioned there are lots of health insurance options out there for immigrants to this country who have a variety of different statuses, and that includes consumers who may be undocumented or have a status of DACA or the Dreamer status that you might have heard of. There are fewer options potentially available for folks that don't have documentation, but there are still some options available, things like family planning only services and emergency services through Medicaid. And our navigators will help families identify what they might qualify for. And in all cases, if someone comes to us and they may not qualify for coverage, full comprehensive health insurance coverage through any of these programs, we'll help them connect with other resources in the community so that they can still get the healthcare services that they need. Now, why are we kind of really excited about Healthcare.gov open enrollment right now? One of the opportunities that we have in this moment, thanks to the American Rescue Plan Act, the latest COVID relief law, is more financial help available through the marketplace for the first time. So because of this additional financial assistance for all income groups, both for 2021, so in this most recent special enrollment period that just ended in the fall, this applied, and for plans in 2022, more people than ever are qualifying for financial help for health insurance. So we're really encouraging folks to come back and look again at the marketplace right now, even if they may have looked in the past and not found something that was affordable for them. And there are kind of, in addition to just increasing the subsidies across income levels for folks through Healthcare.gov, this law also made two really important changes kind of at both ends of the income spectrum. The first, for folks who have income in Wisconsin, it would be just over the Badger Care and Medicaid income limit and up to about 150% of the poverty level, which is about $33,000 for a family of 3 right now. It made $0 monthly plans available for folks in that income range for the first time. And these are plans that have lower cost sharing, so lower deductibles, lower out-of-pocket costs than we've seen in the past. And so that was a big change for folks just over that Badger Care income limit. And then for the first time in 2021, no matter folks' income, they may get financial help through the marketplace. So there used to be kind of a middle income cutoff where after a certain point, no matter how much a plan would cost a family, because they were over this income limit, they were not eligible for financial help through the marketplace. And this law changed that. So more middle income families and individuals are qualifying for financial help now through the marketplace than they have in the past. No one now pays more than 8.5% of their income through the marketplace. And then the tax credits and the financial help make up the rest, regardless of someone's income. What are some other kind of what's new this year in the marketplace? What are some new things? And again, these are, questions that folks might have or, reasons that people might be looking for more information on health insurance right now. The first and foremost, open enrollment is longer this year. In the past couple of years, open enrollment in Healthcare.gov has run from November 1st to December 15th. And this year and moving forward, consumers will have an additional 30 days. So the December 15th date, which is coming up quickly next week, is still important. Folks need to sign up or change their plan by that time in order to get coverage or have those changes be effective January 1st. But if someone misses that date next week, they do still have through January 15th to sign up. So we still have plenty of time to spread the word about these options and the free help that's available out there for folks this year. I just mentioned consumers are getting more financial help for health insurance than ever before this year on the Healthcare.gov side and the marketplace, but also the public health emergency is continuing. And during that time frame, Badger Care Plus and Medicaid members have not had to complete renewals, and they have been able to stay in the program and have not lost their Badger Care or Medicaid, even if their income or their situation has changed. So although folks are not having to go through that renewal process right now, and people may have questions about that because it's been a long time since they've had to complete a renewal, that is because of the public health emergency, but we're still trying to encourage folks to keep their contact information updated if they move or if they have a change to their household situation. they should share that with their income maintenance agency or work with an enrollment assister to update that information, so that once the public health emergency ends, hopefully sometime next year, DHS will be able to contact them when they have to make any changes. And then I'll touch a little bit on this in the end in the context of a resource that we have available, but public benefits for food and housing and health insurance are safe for immigrants and their families to access once again. Under the prior federal administration, there were some changes to what's called the public charge rule that made it such that accessing or applying for some of these programs could have a negative impact on someone's immigration status. And those changes have been overturned. And so we can be clearer in our messaging this year that once again, applying for something like Healthcare.gov or Badger Care or Medicaid will not impact someone's immigration status. And I'll share a tool that we have that if you have folks that are coming in and have concerns or questions about that, that can be shared as a resource. And then more health insurance enrollment assistors are available right now. We have that map that I shared. We have more navigators available right now throughout the state than we've had in many years. So we appreciate any help that you all can give us in connecting consumers to our services. We are out there and we're ready to help folks through this process. So how do you make a referral to an enrollment assister? I think we probably have enough time, so I might go ahead and take us to our online scheduling tool in just a moment, so I can show you all how to access this tool. We have appointments that are available online and just a search of how you can find those free local enrollment assistors that I mentioned through our website. But you can also always give us a call. So I put both of our office numbers on the screen. You can call us at Covering Wisconsin. And we will either answer your question if you have the question, work directly with a consumer that you're referring and answer their questions, or get them set up with an appointment either through us at Covering Wisconsin or one of our partners throughout the state. And we also work really closely with our partners at 211. So because that's a really an easy number to remember, it might be a resource that you all are already using when folks have questions about services in their community. Know that 211 and referring folks there is also a good way to get them connected to us. We do training for 211 staff and have a relationship with them where they often try to actually warm transfer consumers to us, or we have a callback process in place. So if someone reaches out to 211 and is looking for health insurance help, they'll get them connected to us too. So I think I'm actually going to take us to this connector tool briefly. Here we go. All right, so when you come to our website at coveringwi.org/enroll, and even if you just come to our homepage, you'll get a pop-up that will ask if you want health insurance enrollment help, and it will bring you right here. And this is what we call the connector tool, where you can actually search by zip code for a local enrollment assister. If you search here in the Madison area, I'll just put my office zip code in here, you'll actually see options to just schedule an appointment right online. So when you see one of our offices, it will say Navigator Agency. If it's one, it's either Covering Wisconsin or one of our subcontractors, but you'll also see other partners listed, like agents who are doing this work or other partners that are providing enrollment assistance in the community too. So when you see this option to schedule online, you just click on schedule online, and then you'll actually see the appointments that are available with one of our navigators right here to schedule. Right now, the majority of our appointments are over the phone, but if a consumer is requesting an in-person appointment or needs an in-person appointment, we will make that work for them too. And actually, one of our navigators has several in-person appointments available this week, which I just saw on the previous screen. So you can schedule an appointment right online, and all folks need to provide is their first and last name and either an email address or a phone number for us to connect with them for the appointment. I'm also going to show just what it looks like if there may not be online appointments available. In this, you'll see a list then of organizations and their contact information. So again, these are all organizations that have certified to us that they provide this assistance for free, and they provide help both with Medicare and Medicaid and with Healthcare.gov. And then here you'll see Partnership Community Health Center and how they have Navigator next to their listing here. This is how you can tell that this is a Navigator organization as opposed to maybe a certified application counselor or an agent or broker that's providing this assistance too. So if you're looking or you want to connect them with the Navigator, that's one way you can see their information. And then the local contact information is how they would accept appointments. I didn't mention you can also select the language preference. So for example, I'll look for a zip code here in Milwaukee, and I'll put Spanish as the language, and you'll see that we have appointments both at the City of Milwaukee Health Department that are available in Spanish, and also through Community Advocates, which is actually covering Wisconsin, and our Milwaukee office at our Navigator agency as well. And again, you can just schedule right online. So that online resource is one good way to make a referral to connect folks to us. But of course, you also can just give us a call and we will connect you either, like I said, help you directly or connect you with your local enrollment assister. Let's see. Just a few referral tips. As a best practice, we try and refer folks to local help, not directly to Healthcare.gov or the marketplace phone number. Not that you cannot do that. There are many people that just want to go there directly and go through the process themselves, and that's great. But it's also sometimes helpful just to let folks know that there is local help available if you kind of start along that path, start that process, and maybe run into some issues or questions, that you have someone here locally you can call and help navigate that process. We often find that once folks work with an enrollment assister and they become comfortable with that process, it's just they generally have a better experience with navigating this process, and then they want to come back to us year after year. So having that local contact, even if it's just as a backup, is nice, certainly nice to have for folks. And then if someone comes to you and they're unsure if they want to take that next step, or maybe they're just kind of curious, they don't think they qualify for anything, they're not sure based on their income what might be the best choice for them, on our website, we do have a 2-question, really easy tool that just based on someone's household size and income will give them a very quick sense of what they might qualify for just based on those 2 criteria. And then we'll give them some next steps that they can take, either connecting with a local enrollment assister and how to do that, or we'll take them directly to either Healthcare.gov or our Medicare, the Access website, to apply directly there. And then just a reminder that health insurance is obviously really a complicated process. There are lots of nuances here, and sharing all of that information about kind of what the options are and some of those key policy points in the American Rescue Plan and all of the savings that exist right now. I'm not sharing that because we think everybody needs to be an expert in this, but just so that you know kind of what we're helping folks with right now, and that we're here to help. Now, I did want to touch very briefly on tips for avoiding scams. Like I said, I know that folks are coming to you all, and it's helpful for you all to know kind of how you can help people get steered to the right information and not kind of end up in these traps of potentially dangerous scams. So first and foremost, we always remind people that, of course, connecting with free and local and unbiased help is an important way to make sure that folks are accessing these programs appropriately, but also just a reminder that help should always be free. So there are groups out there right now that are kind of taking advantage of this opportunity and maybe offering assistance and then charging for those services. So this type of assistance should always be free, and we and other organizations are here to provide that service and help folks as just a part of our mission. And then we also like to remind people that although occasionally groups like Covering Wisconsin or the Department of Health Services or others may reach out via phone to offer support, there are some good questions that folks can ask to make sure that this is a kind of a legitimate organization that's reaching out to them. And these are some key questions that that folks can ask. Like I said, we are licensed. Agents and brokers in the state are licensed as our certified application counselors. So you can always ask if the person calling is licensed and for their license number. You can also ask if the person calling is showing you all of the health insurance options that are available. That's one way to help avoid kind of getting connected to, only one option when part of our role is to provide unbiased help with all of the options available to a consumer. And then, of course, you can ask if you're offering qualified health plans that meet the standards set by the ACA. That's something that all of the organizations that you'll find in our connector tool, or if you connect with Covering Wisconsin, will do. And then, of course, remembering to look for that .gov. Healthcare.gov and Access.gov are the two legitimate application sites for the marketplace and Badger Care and Medicaid. There are a lot of .coms out there that are trying to steer folks in the wrong direction. So just a reminder to look for those .gov addresses. All right, so what are the key messages that we're trying to get out right now? And then I'll share again at the end some of the resources that we have to help you do that. First and foremost, in the marketplace right now, and since we are in open enrollment, we're reminding people that prices are lower than ever before, and that more people are qualifying for financial help. In relation to scams, one of the things we used to say is if someone tells you a deal that seems too good to be true, it probably is. And actually, thanks to the American Rescue Plan right now, people are really finding options for them for health insurance on Healthcare.gov that seem too good to be true. And so we're reminding people that that is because there was a change, that this is not a scam through Healthcare.gov, that there are actually there is more financial help right now because of that, that change from the American Rescue Plan. And then renewing for 2022. So especially before December 15th next week, we want to remind people that even if they have a plan on healthcare.gov, that it's important to come back and take a look at what the options are each new year, because plans and prices change. And even if someone just enrolled this summer through that special enrollment period, they should come back and take another look at what the plans will be for 2022. So connecting with someone, one of our navigators, even if you have a current healthcare.gov plan, is a good idea to just pursue your options and see if you can find a better option for you for this next year. And then the last key message is just that there's free help out there, and we should connect folks to navigators and other enrollment assistors so that they can help them find the best plan for their health and budget. And finally, how do you do that? So how do you spread the word about not just these opportunities to enroll, but that there is this free local help available, and how you can connect folks to us? First, we have a toolkit of free outreach and promotional materials available on our website, and these include things like social media. Libraries have become one of our best and most successful partners when it comes to social media outreach. Folks are coming to you all for this trusted information, and so especially during the pandemic, some of our library partners and their social media has been really key in connecting folks with our services and opportunities to enroll. So on our website, we have graphics and videos like the one I have in the left-hand corner that our team creates to help promote these services and to allow you to create your own posts that way. We also have printed materials that I can work with you all to personalize with your local enrollment assister information, and then actually get them printed and distributed out to you. Just this open enrollment, for the first time, I've actually worked with 2 and soon to be 3 library systems actually to coordinate mass distributions of materials at a system level out to all of the libraries in the system, which has been a really successful and really cool opportunity for us to do this year. So that is one option too. And we have both flyer size materials that can be hung up, but also outreach cards that are more postcard size and can be just used as a handout in the library. And they're available both in English and Spanish. We also have partners that put together promotional materials. This here is an example of one from the Office of Commissioner of Insurance. We work really closely with our partners at OCI to create these materials, and they're available in Spanish and English, but also in Hmong. They traditionally have just had a social media toolkit, but this year they also have some printed materials on their website too. And then following us on social media, like I said, this has been a really great way to reach people, especially during the pandemic. We have our Facebook and Twitter accounts, but also the Office of Commissioner of Insurance, and then Healthcare.gov and Cuidado de Salud are always posting new information on during periods of open enrollment and throughout the year. And one easy way to spread the word is to just like and share posts that we are putting out ourselves, so you don't have to reinvent the wheel. And we do static posts, just images, graphics, and information, but we also do these fun videos. So I'll play this GIF for you. This is actually from the Office of Commissioner of Insurance Toolkit this year. And we also have longer videos that speak to some of the benefits right now through the American Rescue Plan too on our website. Just some examples of the type of social media content that we are putting out there that can be shared by libraries as well. And then educational resources. So like I shared, part of our mission is not just to get folks connected to free enrollment assistance and help people understand their health insurance options and navigate that enrollment process, but also to do a lot of education around how do you effectively use health insurance coverage? What is the benefit of having a health plan? And so we have how-to sheets on our website at coveringwi.org/learn in both English and Spanish in most cases that use health insurance literacy concepts to break down some of those really complicated health insurance pieces into more digestible resources. And we have them on a variety of topics. Health insurance options is one that I have here. We also have things like what's free with a health insurance plan? How do you get access to preventive care through your health insurer? How do you use a plan network? How do you get connected to a primary care doctor or rides to your appointments if you're on Medicaid? We have great resources on all of those topics available just for free on our website. And then we also have a community resources page where for every county in the state, we have a sheet that talks not just about health insurance resources, but other community resources as well, and contact information for them locally, things like food assistance, housing assistance, those sorts of resources. And those also are available in English and Spanish and available for free on our website. And then when it comes to this public charge support tool that I mentioned, so we are part of the Wisconsin Collaboration on Immigrants and Public Benefits and have done a lot of outreach and support for families who may have questions or concerns about accessing public benefits after some of the changes that were in place in the prior administration. And this tool is still live. It's a free resource, free and anonymous, so folks can text either through their phone, just kind of native phone texting app, or through WhatsApp, or can visit this website and there's a web chat tool and they can ask questions and get responses from reputable sources through this partnership in the Wisconsin Collaboration on Immigrants and Public Benefits if they're concerned about accessing these services. So finally, I just wanted to thank you all for allowing me to come. I'm hoping that we'll have some questions at the end too. But really this, in the middle of this pandemic, I think we all can agree that health insurance is really more vital than ever, and access to healthcare services is just so important right now. And consumers really do better when they have some help with this process. So we have enrollment assistors available through Covering Wisconsin and our partners throughout the state, and anything you can do to help us spread the word locally that we're available, we appreciate. Just if patrons have questions about health insurance, feel free to use our resources to work with me if you'd like some of those. And then, of course, through social media and other platforms, any way that we can help more folks in Wisconsin know that we exist and that we're here as a resource, the better. And then just to close this out, I have put my contact information on the screen. So if you have questions later on, or if you're viewing the recording, please feel free to reach out to me either via phone or email. I would love to talk with you through any of your questions, get you some materials, and just talk about other opportunities for partnership. So I'll leave it at that, Laura, in case we have any questions.
Yes, so thank you, Courtney. And yes, there is a question. Would the Enrollment Assistors be able to help people work through the Wisconsin Access app / website?
Yes, absolutely. So the Access application is for Badger Care and Medicaid, and then other programs like Food Share and others through the Department of Health Services. And our navigators are, that is one of the two main programs that we help folks with. So we'll help them through the application process, but also creating an account so that they can go back and check into the status of their case. We'll also help folks if they're interested in using things like the My Access app, which is an app through the Department of Health Services that consumers can use to upload documents and to get reminders and check status. That's definitely a main part of our role.
If you have questions, there should be a box on your screen in the controls that you can type in a question. Courtney, I had a question. I wondered about what kind of data you keep around the volume of calls that you receive.
Yeah, great question. So we track data weekly on the number of appointments that our navigators are having and the types of calls that they're getting. So not just the number of calls, but the types of calls and the questions that they're getting, because CMS requests that data from us. I don't have the numbers off the top of my head, but I can say anecdotally that this year I was just talking to our navigator program manager, and all of our navigators are reporting that they are meeting with more consumers. They're busier this year than they ever have been in the past, which is great. So I think, you know, partially thanks to a lot of our library partners that are out there spreading the word in their community about who we are and what we do. I think more folks are finding out about us and how to connect with us, and are seeing the benefit of connecting with an enrollment assister. So that's great. Well, we also try to track on how folks are hearing about us. And so we always ask folks to share how they're hearing about us when they get to us. The number one response is always word of mouth. So, and that's word of mouth from, you know, a friend or family member or another trusted voice in the community. So that's where kind of this type of outreach, where we have other trusted community organizations that are conveying to folks that we exist and that we're here as a resource, really does have an impact in terms of bringing people to Covering Wisconsin and our navigators.
Well, I can speak to using Healthcare.gov. The WLA is a small business, and I'm the only full-time employee. So I purchased my health insurance through Healthcare.gov, and just relocating from Iowa, where my insurance was covered by my employer, so I didn't really know. Coming here, none of the companies on the exchange, none of the names were familiar. So I did work with a broker in Iowa who got herself licensed quickly in Wisconsin, so she called me. And I've now switched to someone that's located here in Madison, and switching plans for 2022. And I can tell you that I thought perhaps I would just be able to do it myself, and it's very complex, especially if you want to do something like a health savings account. And so if you aren't someone who has computer skills, if you don't have a basic understanding of insurance and how that works, I was very intimidated by it. And so, you know, if I didn't have access to the internet at home and had to go to a third party to even get that access, I can imagine how overwhelming that must be. So thank you to our library partners for the help that they're giving consumers around the state, and thanks to your office, Courtney, for helping make sure that people are making the right decisions.
Thanks, Laura. Yeah, that's absolutely what we hear too, that the process is so complicated, and it's so beneficial to connect with someone locally that can help you explain kind of what the plans look like here, how they work, and what your options really are. That reminded me of another point just around internet access. And I've gotten the question before if folks need to have kind of internet savvy to work with our navigators, or if they need to have access to the internet, and no, they don't. And actually, that is one of the reasons that we exist as a resource, so that we can help folks who need a little bit of additional help navigating this online system through that process, or if they don't have access to the internet. That's not a requirement to work with our navigators. We'll assist folks over the phone and walk them through that process.
Are there any other questions? I don't see any additional questions. So Courtney, we will share the recording of this webinar, and then I have your permission to share the PDF of your slides.
Yes, thank you.
So we will do that, and that has the link to the toolkit and etc. So you should have access to all of the information that she has shared today, but then there is also Courtney's contact information. If you have questions for her directly, her contact information is there.
Yes, absolutely. And please don't hesitate to reach out.
One more question that just came in.
Oh, okay. I don't see it. Hannah, do you want to share it, please?
Would you also be able to help solo or small business owners?
Yes, absolutely. I am actually in the process right now of kind of putting together a presentation for a group of small businesses, actually, on kind of what the options are for folks right now. Because of the American Rescue Plan and some of these additional subsidies, what I think a lot of small businesses are finding is that their employees may have more affordable options just directly through the marketplace than they are able to kind of negotiate themselves in terms of a group plan through the small business. So perhaps the situation that WLA is in, because sometimes small businesses, they don't have that negotiating power that some of these large companies have to really find a group plan that is cost effective for them, but also cost effective for their employees. So yes, our navigators can definitely work with folks who are employees at a small business or small business owners themselves and trying to figure out what those options are.
Wonderful. Well, if there are no more questions, we will draw today's webinar to a close. And just a reminder that we do have another related webinar happening on Wednesday, the 15th at 1 o'clock. So please visit our website to get registered for that as well. Thanks for joining us, everybody, today. And thank you so much, Courtney.
Thank you. Have a good weekend, everyone.